any questions before we start with procedures? No? Okay. And
Is it a baby?
It's a baby spider.
all right, so preparation of the room. Okay, as I had mentioned earlier when we started this session, I said have your room ready. Because there's a lot of preparation. And if you bring the patient in while you're getting your room ready, the patient is gonna go, wow, these people are really not professional. They might even think you don't know what you're doing because you're gonna be running around like a chicken with no head and it's like everywhere. Because there is a lot of stuff that you need to prepare. You need to clean up the room. The room has to look very nice and neat and clean. All right, make sure you have extra sheets. Make sure you have extra towels. Okay, make sure you have the contrast media already mixed and ready. Okay, and so when the patient comes in, all you have to do is just give instructions to the patient. Okay, this is an exam. Exams where you are doing fluoroscopy, they are more, there's going to be more involved in what you have with, say, when you do a hand x-ray. Do a hand x-ray, the patient comes in and the patient leaves. In this case, you're going to be, it's more involved. You're going to spend at least 20 minutes, 25 minutes with the patient. And so you need to establish a rapport with the patient. So you're going to spend more time with the patient. So the explanation is going to be very good, but have your room ready. Okay. Adjust equipment controls to the correct settings. And the radiologist will tell you how they want the settings. Maybe some they like the patient's head on one side, others like it on the other side. Some like it, you know, with higher kV, lower, you know. So they'll tell you what they want. Have the footboard and shoulder supports ready. Sometimes if you're going to stand up the patient, you're going to need that foot support. Or if you're going to bring the patient in Trendelenburg, you need shoulder supports so the patient doesn't slip off the table. Okay, and so you need to have both that ready. Make sure that if you're going to be doing any permanent images that you have either, if you're not using a DR system, that you have enough CR plates for you to do the imaging. Prepare type and amount of contrast. All right. Preparation, a few more things. Before beginning the examination, the radiographer should describe the contrast media administration to the patient, especially if you're doing a barium minima. In any case, you should always explain. I've been telling you that from the beginning. Have a night. Okay. I said, okay, you have to explain to patients what is it that you're doing. You just don't tell the patient, sit down, put your hand here. You don't do that. Okay? That's not what we've been trying to show you. Okay? You introduce yourself, you know that you identify the patient, you explain the procedure to the patient. But with these exams, because they are more involved, okay, you have to do a better explanation. Okay? Not that you were not doing fine before, but it's just you have to explain every aspect. Many times, and why do I say this? Because many times patients will show up and the doctors don't tell them what they're for. They tell them, okay, you're going to have a stomach x-ray. The patient shows up and the patient may be fasting or not. If it is an emergency, they might not. But if they are fasting, they don't even know why. Okay, they come in and you give them a glass of barium. It's like, what? I didn't know I had to drink this. They were not prepared for it. Okay, and so that's why you have to do the explanation. Let them know I'm going to be giving you contrast media. The contrast media is useful because then we can see your internal organs. Without it, we cannot see them. Okay, and then you can expand on it a little bit more. Okay.
Can you go back one slide, please? I'm sorry.
Yeah, let me finish up here. If you're doing a barium minima, especially, okay, it's important the patient knows what you're going to be doing. Okay, you let them know there is a catheter, there is a tip that it needs to go in your rectum. Okay, I mean there is no if or buts. I mean that's the way, or if or something else. But it has to be that you have to do the explanation. You don't want to surprise patients like, what are you doing? And why? And I'm telling you because I've seen it, okay? Patients will show up and they don't know what they are for. Their doctors don't explain. I mean, how many times have you gone to the doctor and they tell you, okay, take this medication? They don't tell you any side effects. They don't tell you. So it is up to us to let them know what is it that you're going to be doing. And when we get to barium enemas, I'll get very specific about that. But that you need to let them know. Inform the patient that room will be darkened during the procedure. Why darkened? Because it's easier to see the images when it's in the dark. Okay. Introduce the patient and fluoroscopist to each other. Make sure that when the radiologists come in, even if they don't like it, many, not all of them, but many radiologists became radiologists because they are antisocial. They don't like to talk. They don't. Not all of them. Some of them are very friendly. Some of them are, talk. But the majority, what do you see? They are just reading films. That's why they became radiologists, okay? And that's fine. There's nothing wrong with that. I mean, it's fine. And so you have to, it may be antisocial. It's not. Maybe it's too strong of a word. They are very reserved. Okay? Be politically correct. They are very reserved. And no, and by the way, not all of them. I have worked with some radiologists that are, they're very approachable. Some of them, others are not. The majority are not. The majority, they like to stay in their dark rooms and reading films, and that's fine. So you force them to. They need to know. The patient has the right to know who's doing that procedure. And so when you come in, even if they don't like it, you take a time. They're not going to start with you if you're not there, okay? You tell them, okay, Ms. So-and-so, this is Dr. So-and-so. Okay, so the patient needs to be aware who's doing that procedure. Is their right? It's not only nice, it's their right. Okay, if I'm a patient, I want to know who's going to be reading my films. I want to know. Besides, you're going to be paying them. It's not free. Okay, you need to know. I mean, if you give money to someone, don't you want to know who you're giving money to? Yeah, I do. Okay, I do. And so you have the right to know. The patient has the right to know who's doing that procedure. So make sure you introduce them. Okay. Exposure time challenge of GI radiography is to eliminate motion. Okay, and so because of peristalsis. And so exposures, and I'm talking about overhead exposures. I'm not talking fluoro. Listen here. I'm not talking about the fluoroscopy part. I'm talking about the overhead parts. When I say overhead is what you're using with your overhead x-ray tube. Okay? The overhead images, you need to use very short times. Okay? See the difference? I'm not talking about fluoro. Let me say it again. I'm talking about overhead images. Very short times. So you can eliminate motion. Okay? Based upon each region, peristalsis greatest in the stomach and duodenum. Okay? Shows in the distal part of the GI tract. Okay? Peristalsis affected by body habitus, pathology, use of narcotic pain medicine, body position, and respiration. I'm just going to say one thing. Many pain medications, they relax your muscles. Take Sudafed, for example. They relax your muscles. And your GI tract is muscle cells, right? Right? And so they relax too. Just like any other muscle in your body, they're going to relax. And so they're going to move slower. All right, let me go back. What was the slide you wanted?
It was the one before that one.
That one? Okay, take a picture quickly. Yes, Mary.
For the final or for this exam, will we have to look at x-rays and determine the body cavities? Okay.
Yes. Yes. Yeah, x-rays, yes. Yeah, but no, not in lab. Yeah, but you'll have images.
Okay.
Yeah.
Are we going to go over that at some point?
Oh, yeah.
Okay.
Oh, yeah. All right. So let's talk about radiation protection. I'm going to end with this, okay? And then next time we'll start images. But radiation protection is very important here. So let me see. Yeah, boom. We got that. We have that. Any questions? Okay, radiation protection. Now, I said a few things, but I'll say a little bit more. Okay. Shielding pediatric patients and patients of reproductive age is important. Okay? And you can look at guidelines in volume 2. I think now is page 135. Yeah, so, yeah, so it's there. So change at 117 was the previous, edition. Do not compromise clinical objectives of the examination. What am I saying here? That if the lead shield is going to interfere with the radiograph, then don't use it. Okay? Because if it interferes and you repeat the x-ray, then you double expose the patient. So leave it without. Also, remember, in 95% of all the fluoroscopy systems, where's the x-ray tube located? On the bottom. So the x-rays are coming from the bottom up. So the lead shield should go on the table, okay, and not on top of the patient. Okay? Other radiation protection measure, close collimation. And do we have control over that? No. It's the radiologist, but the radiologists are properly trained and they know that they have to collimate. They do that. The problem is with other people that do fluoroscopy and they are not properly trained. And we'll talk about those when the time comes. Optimum technical factors. Okay, now you do have a big role here. You have to set up the KVP, is your responsibility. Okay, you have to set it up. The MA and time, that will be set up by the machine. If the machine is working properly, you will have no problems. Okay. Now, where do you stand when you're doing fluoroscopy images or fluoroscopy exams? The best place for you, and by the way, let me start by saying this. If you're gonna work with x-rays, it is impossible, okay? If you're gonna be an x-ray technologist, it is impossible for you not to be exposed to a little bit of radiation. Say that in the open. Okay? So if you think you're gonna do x-rays and you're not gonna get exposed, forget about it. This is not the field for you then. Okay? It's not that I like you or dislike. No, I'm just saying it because it is the truth. If you're gonna be an x-ray tech, you will be exposed. Now, how and how much you're going to be exposed, that will teach you. Okay? That I can show you. But you're not gonna be, okay, if that's the case, maybe if you're really afraid of radiation, maybe you wanna be a lab tech. Or you will be exposed anyway, but you don't know. So, might as well know that you're gonna be exposed and how to protect yourself. Okay? All right. All right, the best location for you to stand up in a fluoroscopy room is to be behind the radiologist. Okay? Don't feel bad if you're not. That's the best location. You want to be behind the radiologist. Now, you don't have to be breathing on the radiologist's neck. You don't have to be right next to him. No, you can give yourself a gap as long as you're behind the radiologist. Why do you want to be behind the radiologist? Because in that case, you're using the lead shield that the radiologist is using, and the body of the radiologist is also absorbing a lot of radiation. So by the time it gets to you, there's a minimal amount. Okay, so that's the best location. Now, is that possible to do it all the time? No. If you're there to protect you, to help the patient to complete this procedure. And so there are gonna be many times where you're gonna be in these locations if the patient needs assistance. Now, there are patients that do not need your assistance. And if that's the case, you don't have to be here. Okay? Then you can be behind the radiologist. One more thing I forgot to tell you why standing here. Because you have, if you remember the pictures of the systems I show you, there are drapes here. Those drapes are made out of lead. And that will absorb, listen to me, 95% or more of the scattered radiation will be absorbed by that lead shield. When you guys, next year, when we do the fluoroscopy class, we'll do a lab and we're gonna measure the scattered radiation and you will see, okay, 95% plus is absorbed by this. And so if only 5% is going through, it will be absorbed by the lead shield of the radiologist. If 0.111% of it made it through the lead shield, it will be absorbed by the body of the radiologist. And so how much are you gonna get back here? Not zero, it's never zero, okay? Photons never stop, okay? There's always might be 1 out of a million, okay? So it might be 0.00001%, but it's better than being here, okay? Now, let's look at the other locations, okay? Other locations, as you see the yellow, intense or decrease in intensity, that means less and less radiation. So these are not good locations to be, okay? All right, now sometimes you need to be here, taking a step back, okay? Taking a step back. If you double your distance, write this down, because this is the basis for radiation protection, at least photon radiation protection. Double your distance and you will decrease the intensity of the beam by 4. And vice versa. If you get closer, if you decrease your distance by half, you will be exposed 4 more times. And so what you want to do is taking a step back. The more distance you can have, the better it is. If the patient is doing fine and you still need some assistance, you can be here, this area here, okay? And maybe you can take another step back. That's 4 times less radiation. We're good, Mary?
You said that X-ray beams come from under the table and up?
Not always, 95% of the time.
Okay.
Okay, because we do have fluoroscopy equipment with the X-ray tube on top. Are we good with this isocurves? Mm-hmm. Okay, good. There's a few other features in the system. Just give me another 3 minutes, guys. I'll give it to you for free, okay? All right. If you move the bucky, okay, then there is also a shield that will come up from the crack of between the table and the structure below the table. Have you noticed that? Yeah. When you move the bucky on any fluoroscopy table, when you move the bucky up or down, there's this flap that comes up and closes. This is made out of lead. And so also to absorb this is metal usually. Now they're making plastic. This is metal. And so you could have a scatter radiation coming this way, and it's hitting the radiologist right in the pelvis area. And so that's why you have that there too, to also stop some of the radiation. So you have, within the system, you have the lead drapes, and you have this, okay? When you're gonna be in the room, and I don't know why the mask, guys, sometimes if you have a patient with airborne precautions, then you put a mask. Otherwise, you don't. This is not to prevent you from any radiation. I mean, so just if we concentrate on the radiation protection, you need a lead shield, you need a thyroid shield, and possibly goggles, lead goggles. Okay. All right. Now, do the hospitals provide lead goggles? Usually not. So if you want lead goggles, you can buy them on your own. If you have a prescription, they can make them for you. If you have no prescription, I think they're about $80. Okay? But if you need a prescription, then they're more expensive. Okay? That's what you need. One more thing about protective lead aprons. Careful if it is a lead shield that only protects the front. Because if that's the case, if you turn around, then you're not protected. So you need to be aware to move in the direction where you're being protected. All right? Okay. And you might be asking, how come I don't wear a lead helmet? We don't need it. Because the head is not a body structure that absorbs a lot of radiation. Okay? Same with your arms and your legs. You know, you don't protect, you just protect the main organs. Because there's where the problems might come up. Okay, that's it. Thank you. Wednesday we have our test, right?
Yeah.
Good. And then be here on time because I'm going to start the exam at 8:10. Okay, that's the first thing I'm going to do, and then I will lecture. Okay, I have to lecture. I need those 20 minutes. I need them. And you need them. And then your exam, what is it, 5? Exam 5 will be a week from this Wednesday. So it will be, last day of class will be, that will be your exam 5.
What are we covering on exam 5?
Everything on the GI. Everything that I started today. Yeah. And all the GI procedures.